Hi, my name is Marcus Townsend. I'm one of four boys, born and raised in the Washington, D.C. area to two Jamaican immigrant parents. Growing up in the Washington, D.C. area has been a fundamental part of who I am today. D.C. is a melting pot of cultures, and with this exposure, it has allowed me to make meaningful relationships wherever I go. For undergrad, I attended Kenyon College, where I also played football. In my free time, I enjoy traveling internationally. My next trip will be to Taiwan, cooking international foods, and as of late, I've been cooking the national dish of each country that's around the world, hanging out with my friends and family, and going to sporting events. Prior to dental school, I worked with clients with special needs. My responsibilities included carrying them to dental and medical appointments. The appointments were rather difficult, but very rewarding. Being able to see the physicians and the dentists do their job and to provide care to this underserved population solidified the fact that I wanted to work with this group. It wasn't until I got to dental school that I got more exposure to dental anesthesia and our special needs clinic that afforded me the opportunity to work closely with these individuals. From there, it was a done deal. I knew that this population was a population that I really wanted to work with. Advocates' core values of compassion, equality, excellence, partnership, and stewardship align with my approach to patient care as a dental student. High values supported by my faith keeps us honest and allows us to maintain a high level of integrity. These aspects make Advocate a program where I can flourish, grow, and become a well-rounded provider. Furthermore, the leadership that is provided at Masonic is something that I want. I want a program director and residents that are equally proud to be there and are hungry to get better every day. That's contagious, and I know that this is a place for me. I understand that entering the field of dental anesthesiology will require a different level of tenacity from me. I'm committed to putting in the extra hours and effort to solidify myself as a dental anesthesiologist. I learn best when it comes to about 50% reading along with practice problems, and then about 50% of hands-on activity to help solidify my understanding of concepts. I understand that working in a hospital setting can be very demanding and intimidating at times. However, I do feel that I am well equipped to work in a hospital setting as a dental anesthesiologist. My 5 to 6 years of experience working in a hospital and supply chain, I believe, have well equipped me for that. During the pandemic of 2020, when we had a fluid shortage, we sent whatever remaining fluids that we had in our warehouse to our pharmacies so that way they could mix IV fluids for the patients on the floor. From there, I ended up taking a box truck down to North Carolina because our shipment that we had ordered a few days prior would take about a week to arrive. And since we were low, I took the box truck down, loaded up the truck, and brought it back to the hospital so that way our hospital could be running. During my tenure at the local hospital, I was a supply chain lead, responsible for about 10 crew members. During this one particular week, one of my crew members was not pulling their weight. When the time was appropriate, I pulled them to the side just to see how they were doing. They informed me that they were having a rough week and that they knew that their work wasn't up to par. I explained to them that it's not an issue. We just want to make sure that your well being is good and that I would assist in any way possible. At that point in time, I understood that the burden was heavy for this individual, and I took it upon myself to make sure I helped them restock the floors, gather equipment that they needed to be able to do their job correctly. The one instance where I had conflict with a fellow classmate would be the project that was aimed at providing resources to new immigrants so that way they can find dental care. My classmate wanted to create pamphlets and flyers in multiple languages for new immigrants that moved to the Pittsburgh area, whereas I suggested that we create one YouTube video that would be able to be transcribed in multiple languages via YouTube by a click of a button. My classmate wasn't really particularly amenable to that, as they felt that hard copies would be better for the patient. Through healthy discourse, we sat down and kind of went over the pros and cons between having a video and creating these pamphlets. Ultimately, we decided that the pamphlets were not the route to go due to the resources that are required and our low budget. Whereas having a YouTube video, it's easily accessible to all, it's easily translated through the app, and if anybody needs to revisit it, they could. So that was the way that we were able to come to a conclusion on creating a resource that was cost effective and something that would be effective for the population that we were targeting.